Good evening, everyone. Wynn Brown here from Haywood Healthcare with our COVID-19 update for Monday, May 18th. Shout out to my sister who has a milestone birthday today. So happy birthday, Jill, in case you get to see this video. I'm sure Mom will forward it on to you. Just an update on our testing to date. We have tested 4,004 individuals with 3,365 negative results, 434 positive, and 48 indeterminate, putting our rate at 11.3% versus the state at 18.7%. In Worcester County, we have had 9,252 cases, 569 deaths. Franklin inching up to 308 cases with 44 deaths. There have been some questions coming in to us wondering, what has the death rate been from COVID-19 at Haywood Healthcare. We've had a total of what the state classifies as 6 deaths at Haywood. 3 were inpatient since the beginning of the pandemic, and then 3 were patients who passed en route, either in the ambulance coding on the way there or coding in our ER, and were never admitted, but were very sick and were tested either just prior or afterwards to be COVID positive. So I know some people have asked that. So that is the status right now of the rate at Haywood. We've had no deaths at Athol. Inpatient-wise, we've seen a bump up in our inpatient activity regarding COVID-19. We have 6 positive inpatients, 1 in our ICU, 5 on Watkins 2, and then 5 patients that we are awaiting their lab results. So we'll know whether or not they are testing positive or negative shortly, but we treat them like they're positive until they rule out. Also, the governor came forward with his 4-step plan today on reopening the state. You can learn about that at mass.gov/reopening, and there's a graph with the 4 phases with this video as well. And so that is just something that everybody needs to take a look at. Just an update that we're going to be increasing our rehab hours coming up, and there'll be some information on the email for you on that as well, so please take a look at that. And just a reminder of patient first parking, as we expect our volume to begin growing again in the next few weeks. We need to make sure that staff are parking in their appropriate spaces. There's been a number of folks spotted parking closer to the hospital, especially at Haywood, where they shouldn't be, and so please make sure you're parking in the appropriate spots as we return to business in the new normal. So thank you very much, colleagues, for doing that. Also, we need some folks to help sign up for the door coverage for door screening, and there is a link in the email with this as well, and you can click on that and see what's available. And just a thank you to our ongoing support from our network of sewers. That's fantastic. And just remember, as the state begins to reopen and get closer to business in the new normal, that we need to be extra vigilant around our hand hygiene, our physical distancing, and just being super smart out there, everyone, okay? So I hope you had a great Monday. I'll be talking to you tomorrow afternoon, and we'll let you know how the day went. And until then, I thank you all for all you're doing as we continue our journey to be one of the best community health systems in America. Good night.